Thank you all for coming today. We're excited to present the next webinar in our series entitled Steps to the Pre-Health College Career. In this presentation, we'll cover some of the required and recommended things to do in high school and college to be accepted into medical school. Please keep in mind that these slides will be posted to our website, and any resources mentioned will be listed in the slide notes for your use. I'm going to let my fellow presenters introduce themselves, and then we'll jump right into it.
Hi everyone, my name is Helen and I'm a senior at UConn. I have a double major in molecular and cellular biology and Spanish. I'm graduating in 2021 and I'm from Cheshire, Connecticut.
Hello everybody, my name is Smeet Kadian. I am a molecular and cell biology major. Additionally, I am majoring in healthcare and society, which is an individualized major. I'll be talking about that a little later. I'm also minoring in healthcare management and insurance studies. And I'm a rising sophomore from East Lyme, Connecticut, which is a shoreline town in southeast Connecticut.
Hi everyone, my name's Serena Verma. I'm a rising senior at UConn, and I'm studying physiology and neurobiology, which is one of the bio majors here, and I'm from a little town in Massachusetts called Acton.
Hi everyone, I'm Abigail Andrade, a junior psychology major and Spanish minor at UConn, and I'm from Seymour, Connecticut. So we're going to start off with Sumit. He's going to go ahead and tell you about some of the characteristics that medical schools like to see and how important it is to be yourself through the process.
Thanks, Abby. So, like you mentioned, medical schools and all professional schools for that matter are really looking for applicants who have invested time in the things they are passionate about. Really, it's not only about checking all the boxes, but it's about checking those boxes while still giving time to the things you're passionate about. And like you mentioned, being yourself. Medical schools, professional schools, they can easily see when you're not yourself. And when you're passionate about a field or activity, it comes across naturally. Remember, there's only one of you, so you want to be authentic and show professional schools who you really are. And I remember coming into undergrad with the idea that I would have to volunteer hundreds of hours at my local hospital, shadow physicians, work as an EMT, start right away in research, etc. But, after thinking about it a little more, I realized that what matters most is making sure that while I am fulfilling requirements, I'm still exploring other areas I'm passionate about, including student government, mentoring other students both in college and younger, and joining the running club. And now Abby will talk about some core competencies professional schools are looking for.
Yeah, so as Sumit said, I'm going to talk about some of the core competencies that the AAMC, and that's Association of American Medical Colleges, looks for. And while these competencies are specific to medical school, they can apply to many other fields as well, in healthcare or otherwise. An important idea to know is that admissions boards don't only want to hear about how you have these characteristics, but they want to see their application in the things you do, from clubs to classes to volunteering. I won't go over them all in detail, but they're all on the AAMC website. So as you can see, some of these characteristics can be broken down into 4 categories. The first, interpersonal, deals with how you interact with others. Do you have a passion for service and helping others? Can you get your point across and listen effectively? A big one is cultural competence. Many groups don't receive the same care to the same standards because of a lack of understanding or even a bias against the group from their physicians. So it's really important to have physicians who are knowledgeable on this topic. The second category, intrapersonal, looks for an ethical, reliable, and adaptable person. Third, a doctor has to have critical analysis skills, be able to deal with numbers, effectively communicate through writing, and use science to solve problems. They have to create research questions and basically apply what you've learned throughout your undergraduate courses. And that leads to the final category. Of course, as a doctor, you must be able to use your knowledge of science and human behavior to solve problems. So those are some of the core competencies and characteristics that medical schools look for. And up next, Sumi is going to tell you a little bit about choosing the right major for you and whether or not there's the perfect pre-med major. This is something that was briefly discussed in another webinar, but it definitely warrants being brought up again. So go ahead, Sumit.
Great, thanks. So professional schools actually accept a variety of majors, and as long as you fulfill pre-professional requirements for the school you're trying to apply for, students are encouraged to major in really whatever they're passionate about. And it's okay to not know right away. A third of students end up changing their majors, and many students who believe initially that STEM is the only way to pre-health actually end up changing their majors. In fact, more students who were originally in a STEM major decide to change their major compared to those who were originally non-STEM. As the graph on the left shows, There's many kinds of majors that get into medical school. In fact, non-biological science is at the top of the graph with 45% of students getting into medical school from that category. But there are also a lot of biology majors and health majors that also apply and get into medical school, as well as humanities and other fields that are non-science. At UConn, some common pre-med, pre-dent, pre-pharm majors are molecular and cell biology, physiology and neurobiology, biological sciences, anthropology, psychology, nutritional sciences, allied health, pathobiology, biomedical engineering, and even sociology. So there's really a lot of options, and you're encouraged to pick one that fits best for you. There's also individualized majors. Many schools offer these programs if you really can't find one that fits your needs, and I'm actually pursuing an individualized major in healthcare and society, focusing on how different cultures view healthcare and how the United States can contribute to other healthcare systems and vice versa. And this is important to me because I know that as a physician in the future, I will be interacting with a diverse population of patients. Some courses I'm taking for my individualized major include medical anthropology, global health, health law and policy, introduction to epidemiology, and sociology of health. And now Helen will talk about course requirements for various fields.
Thanks, Amit. So it's important to note that course requirements can vary depending on which school you apply to. However, generally speaking, medical and dental schools require 1 year of biology, chemistry, organic chemistry, physics, and English with 1 semester of biochemistry. You may be able to get out of a few classes if you have AP credit, but unfortunately, some grad schools do not accept AP credit, so it can be beneficial to just retake those courses in college. It's also really great preparation for MCAT or the DAT, which are exams you take during your junior or senior year in college or during a gap year. And then during your senior year or your gap year, you would apply to medical schools and dental schools. Some schools also have a list of recommended classes. While these are not required, they can strengthen your application by showing you have knowledge in other areas like genetics, cell bio, microbiome, and statistics. It's also beneficial to have a bit of medical experience, whether through volunteering, shadowing, or research, which we will talk about later. And if this looks confusing, don't worry, because in college you are assigned a pre-medical or pre-dental advisor who can tell you exactly what courses you should take, when you should take them, and just kind of map out your whole college curriculum. Also keep in mind that you have flexibility in college to take additional courses and subjects that you're interested in. Next, I will talk about nursing school requirements. So you can apply straight to nursing school from high school. So if we take UConn as an example, you would simply apply to UConn during your senior year of high school and then declare a nursing major. To get in, you would need a few years of English, math, social studies, foreign language, science, and electives, chemistry, and physics. You would also probably need to take the ACT or the SAT. Again, these requirements differ from school to school. If during college you decide to go into nursing, you just have to apply to change your major to nursing, so you have a bit of time to decide whether this is a career you want to go into. At UConn, you can decide to become a nursing major as late as junior year, so again, you have a lot of time. What's also great about nursing is you have so many options for careers. Currently, UConn and other colleges have programs leading to a bachelor's degree in nursing and degrees at the master's and doctoral level too. If you get an associate's degree in nursing, which takes 2 years to get, or a Bachelor of Science in Nursing, which takes 4 years, you can become a registered nurse or an RN, as seen in the yellow. If you're interested in continuing your education, you could complete a graduate level nursing program to become an APRN, which is an advanced practice registered nurse, a nurse educator, or a family nurse practitioner. Next, let's talk about PA school. So first, I'm just going to briefly explain the difference between a physician's assistant or a PA and a physician. Both are really great career options and both have similar responsibilities in terms of patient care. Physicians have 4 years of college plus 4 years of med school, and then 3 to 7 years of residency. PAs have 4 years of college plus 2 to 3 years of PA school. Doctors tend to work independently, and PAs tend to work in conjunction with the doctor, but recently PAs they have a lot more independence. Physicians have a higher salary, but the cost of school is also a lot higher for them. So definitely do some research if you're curious about pursuing medicine. Again, both are really amazing careers to look into. So some PA school requirements include biology, chemistry, microbiology, anatomy, physiology, English, statistics, and psychology. However, there are also healthcare experience requirements. So you need to accumulate a certain number of hours caring for and interacting with patients, and also have other great experiences like volunteering, which Abby will talk about next.
So, why is volunteering a requirement to apply for medical school? Well, it shows a commitment to serving others, and at its core, that's what being a doctor is about, after all. Volunteering in a health-related position specifically can be beneficial because the more exposure to healthcare, the better. It might help you learn more about yourself and if medicine is the right path for you. Volunteering in a medical setting also shows your commitment to medicine. However, volunteering does not have to entirely be medically related. We've said it before, but it's important to emphasize again that you should follow your passions, and that includes in volunteering. But that being said, you should have at least one strong medically related experience. So there are many volunteering opportunities, especially in college, so you should look around for something that interests you. You can volunteer locally, travel to nearby states, or even go abroad to volunteer in other countries. And you can find these volunteer opportunities in places such as clubs on campus. Pre-med clubs usually have many resources, or you can join a club with a special interest, such as our club, KDSAP, Kidney Disease Screening Awareness Program. While we're not a pre-med club, many of our members are pre-health. And aside from joining clubs, you can also find opportunities by speaking to advisors, or some great ways to find some of these opportunities are by directly contacting hospitals, clinics, nonprofits, or other organizations that may rely on volunteers. And overall, it's important to remember that in whatever you do, you show investment in leadership. Medical schools want to see that you're committed. They'd rather see you participate in 2 volunteering programs every year than 10 different one-time projects. And to admissions board, your commitment to volunteering translates into your commitment to medicine. And a helpful tip that I would suggest is that you document your hours and experiences now and in college, because it's really easy to forget what we participated in years later, and you don't want to sell yourself short. And finally, while you might not write about experiences from high school on your medical school application, that doesn't mean that you can't start volunteering now. Don't feel like you have to wait for college. So, Serena, can you now tell us a little bit about some specific ideas for volunteering?
Sure, Abby. So, like Abby said, of course, medical schools and health schools would like to see that you've had some medical volunteering and some healthcare experiences. But at the end of the day, they want to know that you care about others and you're ready to serve and you're ready to have be able to make interpersonal connections with others. So UConn is actually an excellent place to find volunteering opportunities because there's a community outreach office. They hold many different community service trips domestically and abroad. And there's so many clubs that are devoted to service, health care, and non-health care. So a couple of things that I personally have taken advantage of is UConn's community outreach program. And one thing I did last semester was I did a semester-long volunteering program at a local nursing home. And the nursing home was actually just 5 minutes from campus. I didn't even know it was there, but it was such an amazing opportunity because it was kind of a clinical experience because these were all elderly patients suffering from neurodegenerative diseases and they had certain disabilities, but at the same time, it was just about working with people, about thinking about creative activities to plan, and it was really fun. And it was sustained and it showed that I was committed to this population and I had a really good time. Another thing that I've taken advantage of is UConn's alternate breaks. So it's a really good program in which during like a spring break or a weekend trip, you get to go out to a different part of the country that you've never experienced before. So my trip was to this little town in Tennessee called Cosby. It's in the Appalachian Mountains. It's very beautiful, but very remote. And there's also a lot of rural poverty there. So I got to experience something that I've never seen before. I learned about rural poverty, why it was happening to this area, and I really understood the residents of in a way that I'd never gotten to before. So that was an incredible trip, and it was a week long, and it was amazing. I made really good friendships, and I learned so much. And also, you can just get involved in anything. In the areas, there are soup kitchens, there are shelters that you can go and volunteer at once a week. Lots of clubs at UConn also have a more global focus on volunteering. There are MedLife groups. There is this club called Huskies for Haiti. A lot of them actually take trips to countries in medically underserved countries, and you can actually get hands-on clinical experiences in these countries and learn about healthcare in other places that are very different from here. And there's this other program some of our members take part in called Jumpstart. So if you like working with children, you get to go out to local elementary schools and work with children after school, and it's just a lot of fun. And it's another thing that med schools love to see, that you can work with people of all different ages and demographics. And then lastly, we have our club over here, the UConn Kidney Disease Screening and Awareness Program. And I joined this club because not only do you get to go out and really experience the community hands-on and learn about the people near UConn, but you also get to pick up valuable clinical skills. We monitor people's blood pressure, blood glucose, we do urine analysis, and we get to talk about people's medical records, and we have an attending physician who comes with us, and I've learned so much from this experience that I would definitely recommend getting involved with a club like this when you enter college. But of course, you can start, just like Abby said, at any level with volunteering, even now. Next, Helen is going to tell us a little bit about shadowing and why you need to do that to prepare for medical school.
Yeah, so there's a lot of reasons why you should shadow both in high school and college. So when you shadow in a hospital or private practice, you get to see all kinds of medical career options like APRNs, physicians, and PAs. You get to observe what they do on a typical day, and you can learn about, why they chose their careers and how they got there. And shadowing during high school gives you kind of a leg up because you're learning about different careers so early on in your life. And by shadowing in college, you can learn more about careers you're interested in and get shadowing hours. And this way you can convey to admissions committees that you're interested in a certain career path and that you've put in the work to do so. So how do you find shadowing opportunities? You can simply just speak to your own physician and see if you can just stop in once a week. And also feel free to use your personal connections. So talk to your family members and friends and see if their physicians are willing to let you shadow their office. Another great resource is a pre-med advising office because they might have some really cool opportunities in contacts with local physicians. Next, Serena is going to talk about research.
Yeah, so another thing that a lot of graduate and medical schools are looking for these days is involvement in research. And what exactly is that? It sounds kind of daunting, right? But all research is joining a lab and learning how a lab works and contributing in some way. So there's many ways that research actually works. So you might imagine someone in the lab with test tubes and pipettes, but research has so many forms. You can be doing bench work like you can see in this picture. But you can also do a lot of data analysis. You can do coding. You can do modeling. You can also work with human subjects in a psychology lab or a nutrition lab. So basically, med schools are looking for this because when you engage with research, it's like you're going above and beyond normal classroom learning and you're applying what you've learned and really using those critical thinking and analysis skills. So another reason to do research is obviously you get to know a professor pretty closely, and it's when you apply to medical school or health school, you want a letter of recommendation usually. So after you've done research in the lab for a while, you form this close relationship and mentorship with the professor, and usually they'll be able to write you a pretty good letter by the end of that. So like I said, research can take on many forms. When I first began college, I was in a neurobiology lab working with mice, and I really liked it. I learned so much, but I realized it wasn't really for me, and I wanted to actually work with human subjects, and I was more passionate about nutritional science. So I started working in a nutritional science lab, and I realized that that was also very applicable to what I wanted to do with my life because my research was really relevant to health, and I was looking at the impact of diet on the onset of cardiovascular disease. So it was really relevant, and I'm glad I took the risk and kind of veered off the path because I found something I was passionate about. And how do you get started? So when you enter college, most people try to find a research lab within the first year. And I would just go to the faculty pages, look through different departments, and just start reading up on different projects that are being done at your school. If something looks fun to you, just send them an email. Say, I'm a student at this university. I'm interested in your work. Can we meet for a bit and talk about it? And you'll be surprised because people are there to help you succeed and help you learn. So don't feel like you are not ready or not, if you don't know enough or don't have enough experience, because that's what doing research on the undergraduate level is for. It's for getting experience. So yeah, believe in yourself and you can do it. Now, Sameet's going to tell you a little bit about why it's important to also do clinical work.
Yeah, thanks, Serena. So when I started my undergraduate career, I kind of wondered what clinical work was exactly. And clinical work is volunteering or working in an environment where you have direct patient contact. So why pursue clinical work? Why are professional schools looking for it? Well, first of all, clinical work gives insight into the intricacies and challenges of effectively providing patient care. Secondly, it shows admissions that you've had exposure in the field. So what opportunities exist for both high schoolers and undergraduates to pursue clinical work? One of the most common ones is a medical scribe. Students follow on-call physicians into an exam room where they document patient information into the patient's electronic medical record. And this lightens the administrative burden on the physician and teaches students some common medical terms. So it's a two-way street where both the physician and the student are benefiting. A second opportunity is CNA, or volunteering at healthcare facility, clinic, or living assisted facilities. Hospice volunteers usually assist patients at the end of life. A CNA, or certified nursing assistant, helps patients with activities of daily living and other healthcare needs. And if you're interested, you should look for living assisted facilities near you where you can volunteer, or for a CNA certification course. Another opportunity is an EMT, or an emergency medical technician, which is an entry-level healthcare provider that responds to 911 medical calls or transport patients from one medical facility to another. This is a great experience, but you have to find a course. There are many summer courses that work well for students' schedules, and they can be found on the Connecticut Department of Public Health website, which is linked here. My personal experience as an EMT has been very rewarding, responding to patients who need medical assistance, and I've learned a lot about various conditions and how to remain calm in stressful situations. Another opportunity is medical assistants and emergency room technicians. MAs and ED techs work alongside physicians in clinical settings and perform a variety of functions, including using computer applications, answering telephones, welcoming patients, taking medical histories, preparing patients for examinations, taking EKGs, taking vitals, a lot of different activities. And if you're interested, you should look for certified medical assistant courses. And to become an emergency room tech, you should look for job openings where you're interested in working and look at the requirements. Some might only require basic life support certification and previous healthcare experiences, while others require applicants to have an EMT license. I want to share a quote with you all from the University of Colorado that summarizes clinical work well. It reads, "Selecting positions that allow pre-meds to offer sustained contributions to patient care while also offering exposure to a wide range of healthcare issues hits the sweet spot for a meaningful experience." And now Abby will talk about pre-med opportunities available to students during a pandemic.
Thanks, Amit. So this year has been unique in many ways for everyone, including pre-health students. Many of our plans were cut short or canceled entirely due to the COVID-19 pandemic. However, that does not mean that we have to stop working toward our goals. There are lots of opportunities that now are just in a new format. For example, volunteering is definitely still possible. You can tutor or fundraise online. You can do your part through activism on social media, sharing knowledge and bringing important issues to light. You can collect personal protective equipment, such as N95 masks for hospitals and healthcare workers, or you can buy groceries for elderly neighbors. Another opportunity is 7 Cups or other crisis hotlines. And with these programs, you can volunteer your time helping people in mental health crises. Shadowing, however, is a little bit more of a difficult area. Many places where pre-med students would typically shadow, such as in hospitals, doctors' offices, nursing homes, those are closed to the public. Some are slowly reopening, but many may be closed to shadowing for a long time. However, there are online virtual opportunities, and an example of this is Club Med SHU. This program is run by students at Siena Heights University, and it brings healthcare professionals from a variety of backgrounds, positions, and specialties to students through Zoom meetings, where the professional can share their experiences, the steps to get to where they are, and even go through a case study with students. Students can ask questions and still receive some insight, even though they would not meet in person. Another common opportunity is getting some experience through contact tracing. You can contact your state health department to see if you can help identify those at higher risk for contracting COVID-19. In this position, you would call people who tested positive to help find and warn those they have been in contact with to get tested. Some positions are paid, some are volunteer, and the education level will vary between positions. Some require a master's degree, whereas some require a high school diploma, so it really depends on the program. And finally, you can still be involved in research, though it might look different. Many professors are still happy to have help, as much as research involves reading through articles and data analysis, both of which can be done from home. And like volunteering, you can also start shadowing, contact tracing, and finding meaningful health-related experiences now. You don't have to wait for college. So next up, Helen is going to tell us a little bit about the steps that you can take now and the steps towards applying once you're in college.
Thanks, Abby. So as high schoolers, applying for college may or may not be on your mind, depending on what year you are. So if you are interested in medicine, now is a really great time, as Abby said, to explore different options through volunteering or shadowing or research. And if you're really committed to having a career in medicine, you can apply into programs as a high schooler that guarantee you a spot in medical school, dental school, or DO school, or pharmacy school also. These are really great programs because it takes off a lot of the stress that comes with applying for graduate school because you have a guaranteed spot as a freshman in college. UConn has a really great medical and dental guaranteed program that you can look into. It's called the Special Program Medicine. So definitely look into that if you're interested. I'm in it. It's a really great program. During college, you can also take the required courses, get involved in some clinical and non-clinical experiences, study for your standardized tests like the MCAT or PCAT, and get letters of recommendation. So you have to talk to your professors or your advisors or physicians you shadow. So it looks like a lot to do, but I can say that as a pre-med student, you really have so much time to explore other interests, get involved in other clubs, and just enjoy your time in college. For example, I'm involved in KDSAP, and I'm also a competitive ballroom dancer. Next, Serena will talk about DO programs and other types of positions.
Thank you, Helen. So there's also other types of positions that exist other than the regular medical doctor that we know of. First of all, there's doctor of osteopathy. So osteopathy is very similar to an MD, but there's a little additional training on manipulative medicine. So it's using your hands, more hands-on work to manipulate the musculoskeletal system to treat and prevent disease. And there's also a focus on more holistic medicine. So if you're interested in holistic health and wellness, then doctor of osteopathy is a great option because you can do anything that an MD does. You can specialize or you can go into primary care. And it's just a little extra training. There's also a doctor of podiatric medicine, and I didn't know this until recently, but there's a whole nother school for learning how to treat disorders of the foot and ankle, so maybe try shadowing that, see if you're interested. And then there's also doctor of optometry. You probably have been to the optometrist where you check your vision and you get prescribed glasses or contacts. So that's its own type of physician. It has its own school. All of these have their own application portals. So making sure that you know that beforehand if you want to apply and making sure you have everything in line when it comes to application season, because actually all of these their stats, their MCATs, and their GPAs are actually a little bit less competitive than MD programs, mostly because they're just not as well known about. So definitely talk to your advisor about them and start thinking about them early because they're really great options and they're all types of physicians just with a little bit more specific training. And now we have come to the end of our webinar and we'll leave you with a couple of takeaway messages.
Yeah, so firstly, remember that there's always flexibility in what you decide to do with your career. Shape your path and explore what you want, making sure you take classes and pick a major you're passionate about. If you don't pick a major you're passionate about, it's going to be a very rough 4 years. And remember, changing your major is always acceptable. Advising and mentorship, you're not in this alone. Remember, you have advisors and older students to help you when you need it.
Also start early. I would say start early for some things. When I first came into my undergraduate career, I actually wasn't sure if I wanted to pursue medicine, but just in case, I took all the classes and I started seeking out volunteering and research, and that really helped me later because I got everything done at a good time and now I'm applying. So start early, but then also know that if you do decide to pursue medicine later, you have time, you'll be fine. But yeah, don't worry too much.
And yeah, jumping off of that, taking a gap year after you finish college is also okay and oftentimes beneficial. So during this time, students can pursue internships, earn money, gain experiences that just strengthen their application for grad school. And in fact, the average age of medical school students is increasing because more students are taking a gap year, and it can really strengthen your application if you are productive during this time and explain it well during interviews. Just remember that there really is no set path to becoming a physician or a dentist or really anything, or there's no perfect way to pursue a career.
So along with that, remember that to follow your own path and just make sure you do fulfill the necessary requirements. In college, it's easy to fall into the trap of asking yourself if you're checking everything off the list, or if you're doing as much as the pre-med student to your right. But while you do need to have certain experiences, it's important to remember that it's your life, your unique path, and you should follow what you love. You know, comparing yourself to other students doesn't do you any good. So with that, we're going to wrap up this presentation, but please feel free to email us, contact us with any questions you might have at our email uconnkdsap@gmail.com. We'd be happy to answer any and all questions about UConn, our club KDSAP, and the pre-med experience. So thank you all for coming today.
Thanks, everyone.
Thanks,
Bye.